I'm Kim with Stretch Physical Therapy and Total Wellness, and I'm looking forward to help you start on the road to recovery from your back pain. Now, most likely you are here today because you're experiencing pain in your back when you're bending forward, or maybe you've been told that you have a herniated disc from a doctor's visit. So today I'm going to give you a video that will show you 3 exercises that you can perform in your home to get relief and take the pinching off of the nerve right now. Now, you've probably taken my 30-second self-test that shows that you have sciatica and you feel like you're dealing again with a herniated disc. Here are a list of the symptoms that you'll typically find if you truly do have a herniated disc. Number 1, know that if you've been diagnosed with a herniated disc, that 90% of the population has been diagnosed with a herniated disc, and they may not be symptomatic. Therefore, you need to find the root cause of your problem, because just because you have a herniated disc doesn't mean that the disc is what's causing you the problem. A few signs and symptoms of a herniated disc is that you feel pain when you're standing up tall after bending forward. You may experience pain when you're bending forward and lifting something up, and after that you get shooting pain down the side or the back of the leg. This isn't good. Any pressure on the nerve can cause permanent damage, and as soon as possible you need to make sure that you get the pressure off of that nerve so that you don't cause any permanent damage. So if you're ready, I want to teach you 3 exercises that you can perform in your home to help you relieve and take the pressure off of that nerve. I'm going to have Megan come and lay down. And Megan, I want you to lay down on your stomach for me to start with. Okay. In this position, again, you lay on a bed if you can. I want you to lay just in this position so that you're flat. And the first thing I want you to do is any pressure or tension that you have in your lower back, I want you to take 3 deep breaths in and try to relax the area in your low back. Now, if you're not experiencing any pain with this, then I want you to take a breath, hold it for 5 seconds, and blow out any pain that you are feeling. So you're going to take a deep breath, blow it out. Good. And I want you to do that a few times first, just to make sure that you can relax that low back area. In this position, you shouldn't feel any pain, any tension, and you should not feel any pressure running down the leg. If you're feeling pain at this point, then you need to give us a call right now so that we can get you in and do some manual therapy. For those of you who are not experiencing any pain in this position, then I want to teach you 2 more exercises that you can do at home to relieve the pain. Okay, gently, Megan, I want you to come up onto your elbows for me. Now, when you're in that position, don't come up any further. I want you to relax your glute muscles and just let this area sink down. If you have pain with this and it's too severe, then you want to go right back down until that position to where you're just breathing and relaxing the low back. If you're okay with this position, I want you to stay here for about 30 seconds. Hold it, try to relax the low back area and relax the glutes. And then after 30 seconds, you can go completely back down into this resting position. Now, I'd like for you to do that 10 times. So come back up to your elbows, again, relaxing your glute muscles, letting this drop down. Hold it for 30 seconds. Now, typically a herniated disc is diagnosed in people who are age 18 to 35. Typically it occurs because you've not used proper body mechanics and you bend over using your backs and lift something up. And what that's doing is it's taking the disc that's in between the 2 vertebrae in the back, and it takes it and presses it backwards. And when it does that, the disc is pressed between the 2 bones, causing it to do what we call is herniate. And when it herniates, it's like a jelly donut. It takes the jelly out backwards, and then that herniation is pressing on the nerve, and the nerve runs down the back of the leg. So you're going to finish these exercises on your own, hold it for 30 seconds, But we're going to move on to the next exercise, and it's going to be a little bit of a distraction for the lumbar spine. So Megan, I want you to go ahead and get up into a sitting position and then roll to your back. Now for this exercise, you're going to need a towel that's rolled up pretty firmly. And you want to bring your feet flat, bend both of your knees for this exercise. You can use a pillow, whatever position makes you the most comfortable. And in this position, I want you to lift your hips up. You're going to place that towel on the back side of your pelvis here. If you already feel a pull in this position, then this is enough of a distraction for you at this point. It just depends on the severity of your herniated disc. If this is tolerable, go ahead and lay your legs out straight. Opening up the hips, you're giving a good traction to the lumbar spine, separating each of those discs between the vertebrae. Now this is a picture I've got drawn, and what we're doing is pulling that apart so that we take the pressure off of the nerve. You want to hold this exercise for about 1 minute. If you're feeling any tension or it's too painful, immediately bend your knees back up into a resting position. This is not a no pain, no gain exercise, and you want to make sure that you're doing this and you can fully relax the low back. Now that you've done that, lift your hips up, remove that towel roll. You want to bring your knees to your chest. Hold on to it, and what you want to do is just sort of rock the knees for about 30 seconds. All right, so again, we're opening up that disc area so that we're taking the pressure off of the nerve. Now, even after just one set of this, what you should be feeling is the pain from the pressure on the nerve should be going from wherever it was to start with. So, for example, if you're leaning forward and you feel pain, your pain may go all the way down to your foot. If you're feeling pain or numbness all the way down to your foot, what we're trying to do with these exercises is to get it to move back up towards the center of the back. Successful treatment is that that nerve is going back and centering in your lower back. If while you've done these two exercises, you feel that your pain is just in your back, and you don't have any nerve pain going down your leg, that is successfully removed the pinching on the nerve and the herniation. If that's the case, then you can do a stabilization exercise to help stabilize your lumbar spine. And the way you're going to do that is you're going to do a pelvic tilt. And that is pressing your low back flat into the surface below you. Hold it for a count of 5 and then relax. Now, again, if you don't have the pain running down your leg, I want you to perform a pelvic tilt, and I'd like for you to perform 10 of them, holding each of them for 5 seconds. While Megan is doing that, I want to explain what's happening in your back, why that nerve is pinched, and how you can prevent it from being pinched again. Most likely, if you've been over and you've pinched that, and your symptoms have returned back to the center of your back, you can now just stabilize the back, and most people will actually feel better within a couple of days and it won't come back. However, if you keep experiencing it because you keep bending over incorrectly and you're not using the correct techniques, then physical therapy is warranted to teach you techniques so that you don't press on that nerve and pinch the nerve. Now, if you're able to take care of this on your own, this will be a good video that you can use as a tool to help you so that if it does happen and you can get relief from that pain with these 3 exercises, then that's all you need to do. So again, the 3 exercises, you're able to perform those at home. Thank you, Megan. So if you're one of the few people that actually continues no matter what you do to lift an item and you pinch that, or you can't get the nerve unpinched and you can't get that nerve pain to center back in your back, that it's important for you then to seek out treatment for it. Now know that surgery and injections should never be your first choice. It's not your first choice because you're only masking the signs and symptoms if you get an injection. It doesn't fix anything. If you take medication, you're only masking the signs and symptoms. You really want to see a physical therapist to relieve the pressure and to center that pain back in your back so that the nerve is not consistently pinched. Again, if you keep the pressure on the nerve, then you're going to cause permanent damage. That is just not something you're going to want to live with for the rest of your life. If you're seeking out care, what you want to look for in a physical therapist is someone who's going to do traction if traction is necessary. If a doctor is giving you an order and they say they want you to have traction, not all instances mean that you have to have traction. You may have a lumbar spine that, because the muscles have been turned off for so long and you're so weak, may be so mobile that we need to look at maybe the thoracic spine to see if you're stuck in the thoracic spine or if you have a problem with the SI region. It's not always that your herniated disc is coming from the lumbar spine and you need traction. Typically, what we're seeing in our clinic are people coming in, their thoracic spine is not moving. They have a hypermobile lumbar spine, so we have to do grade 5 mobilization techniques to the thoracic spine and get it moving, followed by manual therapy and stabilization exercises to stabilize the lumbar spine and make sure that the pressure is taken off the nerve. Now, successful treatment with physical therapy that uses grade 5 mobilizations typically takes about 8 to 12 weeks. So if you're not ready to seek care right now, I fully understand. Going to physical therapy may be a little scary. Maybe you've had physical therapy before and they only did exercises and you really didn't get relief from the pain. What we do want you to do is get the pressure off of the nerve. So give us a call. We'd be glad to send you some more information on some exercises that you can perform at home so that you can take the pressure off the nerve. Know that if you take the traditional route and go to your doctor, you may have to get x-rays, MRIs, possibly get an injection. And again, you're just masking that pain. These 3 exercises will help you at home, and if they do help you, that is great. For those of you that it doesn't help, please pick up the phone and give us a call. We'd love to be able to help you get rid of the pain. Our number is 513-874-8800. You can check us out on the web at stretchphysicaltherapy.com.